Bismillahirrahmanirrahim. Assalamu alaikum, dear students. Hope you all fine. This lecture is for grade 7 boys and girls both wings, subject science, chapter number 1, and lecture is second lecture, and I am Mrs. Saira Jamal. The topic which we are going to discuss today is about the disorders of digestive system. There are many problems of digestive system, but the most common problems are diarrhea, heartburn, constipation, ulcer, and gas trouble. What is ulcer? The mucous membrane breaks which fails to heal. But here we shall discuss only diarrhea and constipation. What is diarrhea? Loose motion or diarrhea is the condition of having three or more loose or liquid bowel movement in a day. Normally, a person he or she use washroom for feces excretion at least once a day. But in this case, in diarrheal condition, the patient uses washroom three or more than three times. It is a common cause of death in developing countries and the second most common reason for infant deaths worldwide. Why most of the infants they died of diarrhea? The reason is due to the loss of fluids during loose motion, which can cause dehydration and electrolyte disturbances. What happened during diarrhea as the feces is semi liquid feces, and it have water in it, also it has salts in it. Those salts contain the ions, and these ions are very important for our body. And when these ions are excreted out along with the feces, then in turn dehydration and the loss of the electrolyte takes place in the body, which may cause the death of the infants. Dear students, in this image you can see a normal large intestine and diarrheal patient large intestine. In a normal person, what happened? The water is absorbed by the large intestine, and then what happened? The undigested food is converted into feces, and the feces which excrete out is in the solid form. But in diarrheal condition, what happened? The undigested food is still in the liquid form, semi-liquid form. The water is not absorbed by the large intestine, and this also the semi feces or semi-liquid feces also contain these ions, potassium ion, chloride ion, and sodium ion. They are also called electrolyte. And then this semi-liquid feces excrete out in the form of a semi-liquid stool, and a person may go to, because as its excretion is easy, so the person the rectum cannot uh, keep it for a long time, and then the patient have urge of washroom. What are the causes of diarrhea? Anxiety means stress, feeling fear, especially during exam. Most of the students they have examinaria, which is examinaria is feeling fear from exam. Excitement, sudden excited news, because diarrhea is connected to brain and taking antibiotics, so side reaction, infection, taking contaminated food. When you will not wash the fruits and vegetables, so they have germs and dust on it, that is called contaminated food. Food intolerance, when some people they have allergy from specific food. Food poisoning, and travelers diarrhea. There are two types of diarrhea: sudden diarrhea and chronic diarrhea. Sudden diarrhea is due to food poisoning. Travelers diarrhea, when you go to Pakistan and when you take local water or when you drink local water, then you also suffer from diarrhea. The reason is the water quality changes, and then in turn we suffer from diarrhea. Stomach flu is a type of intestinal disease, and in this case also the patient suffer from diarrhea. Chronic diarrhea means prolonged diarrhea or persistent diarrhea. One of that type of diarrhea is in celiac disease. Celiac disease is a type of disease in which a patient have allergy from a special type of protein which is present in bread or in wheat, that is called gluten. And food intolerance, some people they have allergy from peanuts, and when they eat peanut then they got diarrhea. Some people have allergy from dairy products and from soy. And some people have, when they take a medication, especially antibiotic, they also have diarrhea. IBS is irritable bowel syndrome. It is a type of large intestinal disease, and in that case also the person suffer from diarrhea. What are the symptoms of diarrhea? Abdominal pain, cramping. Cramping is a painful muscle contraction which cannot be controlled. Bloating is gas in stomach. Nausea, feeling vomits, loose motion, the semi-liquid feces, fever, high temperature, and sometimes blood appear in stool. These are the symptoms of diarrhea. Cramping, abdominal pain, and bloating. Gas in stomach are the symptoms of diarrhea. How can we prevent diarrhea? Prevention from diarrhea, we can prevent diarrhea by following the tips given below. Number one, always wash your hands with soap after using toilet. Wash your fruits and vegetables before cooking or eating. Don't eat uncooked meat and eggs. Always drink clean boiled water. Some common digestive problems I told you are diarrhea, heartburn, constipation, ulcer, gas trouble. Diarrhea is passing semi-liquid feces. It may be caused by an infection, eating contaminated food, reaction to some medicine, anxiety, excitement. Symptoms I told you: abdominal pain, cramping, bloating, nausea, loose motion, fever, and bloody stool. Diarrhea can be fatal, I told you, due to dehydration and loss of the electrolytes from the body. It may be fatal. We can prevent diarrhea by washing hands with soap after using the toilet. Wash our fruits and vegetables before cooking or eating. Don't eat uncooked meat and eggs. Lemonade is the best drink in diarrhea. Also in summer, because in summer also dehydration takes place due to sweating. So drink lemonade, which is a good drink for health. Second type of disorder of digestive system is constipation. Constipation is the painful or difficult passing of feces. The person cannot pass the feces, and when he or she is trying, they feel pain. So during the period of constipation, some person may pass feces three or less than three times a week. Again, I told you that normal person can pass the feces once a day, but the constipated person, even in week, they pass three or less than three times, which is very harmful for the body. You can see in this image the painful passing of feces in case of constipation. What are the causes of constipation? Lack of physical exercise, not drinking enough water, delay in going to washroom, taking food low in fiber. What are fibers? Fiber is also known as roughage, is the indigestible part of plant food. Indigestible part of plant food means that the food have some part which are not digested by our body. The reason is that the enzymes which are required for their digestion, they are not present in our body. So they are indigestible, but still they are very important for the digestive system. How and why are they important for the digestive system? We will discuss it in the next slide. But before going in to the application or role of the fibers, let us see what are the food rich in fibers or sources of fibers. Cereals like wheat, corn, barley, and oat. And in fruits, pears, guavas, grapes, oranges, and apple. In vegetables, spinach, mustard, and cucumber are the best sources of fibers. In this image, you can see wheat, barley, rye, rice, maize or corn, oats. They are the sources of fiber. So always use these cereals in your meal. In this image also you can see there are some cereals, fruits, blueberry, grapes, kiwi, strawberries, which are rich fibrous fruits, cabbages, asparagus, and beans, the chickpeas, and some other cereals. They are the like the wheat seeds, they are very good and they are very rich sources of fibers. What does fiber do for the body? What are the functions? What is the importance of fiber? Fiber, although they are not digested by the body, but still fibers are good for digestive system because fiber holds water and soften the feces in large intestine so it can pass out easily, maintain blood sugar level, keep our digestive system healthy, maintains cholesterol level and prevent heart disease. As cholesterol level is balanced, so it means that we will not get from heart attack. Prevention from constipation, we can prevent constipation by adopting proper lifestyle. Adopting proper lifestyle means that sleep in time, wake up in time, take food in time, be relaxed, don't get tense because tension is the main cause of constipation and diarrhea because constipation and diarrhea they are connected to brain. Taking regular exercise, eat lots of fiber food, drink plenty of water and going to washroom when we have the urge. Don't get late. Healthy life, we will have a healthy life by drinking plenty of water, by eating healthy food, avoid junk food, take regular exercise and reduce stress. Dear students, these were the two problems of the digestive system, diarrhea and constipation, which I explained. The next topic is about the respiratory system. What are the parts of respiratory system? They are nose, throat, trachea, bronchi, and lungs. In this image, you can see the parts of the respiratory system: nose, epiglottis, larynx, trachea, then bronchi. After bronchi, we have two lungs. In lungs, the bronchi divide into small tubes called bronchioles. At the tip of each bronchiole, tiny air sacs called alveoli are present, and alveoli are surrounded by blood capillaries. Two type of process takes place in respiratory system: breathing and respiration. Breathing is a physical process and respiration is a chemical process. Breathing is a physical process because in this case only inhalation of air and exhalation of air takes place, or in other words you can say that we can take inhale oxygen and exhale out carbon dioxide. Respiration is the process in which energy is generated by the cells. In cell, what happened? The glucose is broken down into simpler form or into the final product, which are carbon dioxide, water, and a large amount of energy is released. That energy is utilized by the cells for different functions. Then parts of respiratory system. The parts of respiratory system, the first part is nose, second is throat. The air enters through our nose or mouth. Our nose has hair and mucus to clean, moisten, and warm the air. Mucus is a sticky liquid, dust particle, and germs which are present in the air. When they enter in our nose, they stick to the mucus and then in turn will not move inside our throat. The air enters the throat and passes through the larynx. Our vocal cords are also present in the larynx to produce. So in larynx, epiglottis is present and also the vocal cords are present. The vocal cords are the two loops which produce sound. You can see in this image that this hollow tube is called trachea, and trachea is surrounded by the left and right vocal cord, and then at the tip, at the top there is epiglottis. Epiglottis close this trachea when we are taking food or when we are eating food. Our throat contains two pipes, one for the food and the other for breathing. It is the epiglottis which allows things to go down the right way when we eat or drink something. The epiglottis covers the windpipe. In this diagram, you can see there are two tubes. One is the food pipe and another is the windpipe. Through food pipe, the food passes and through the windpipe, air goes inside the body. This is the video, students, which will help you in understanding the function of the epiglottis.
There is a passageway through which air travels from the nasal cavity to the lungs, through the nasal cavity, through the nasopharynx, oropharynx, laryngopharynx, and then the larynx and trachea. There is a food passageway through which food travels from the mouth into the stomach. Food passes from the oral cavity through the oropharynx, the laryngopharynx, and then the esophagus. The epiglottis is the band of elastic cartilage in the larynx, which closes when we swallow, and thus forces food to travel from the laryngopharynx into the esophagus. This food should not pass into the larynx, or else we would block an airway and potentially suffocate. So it is the epiglottis which saves our lives every time we swallow, forcing food into the food passageway and preventing it from traveling through the air passageways. This animation depicts how air is permitted to travel from the laryngopharynx into the larynx and trachea while the epiglottis is open. However, when food attempts this passageway, the epiglottis closes over the glottis, the opening of the larynx. This then forces food into the esophagus. Thus, it cannot block the airway when we swallow.
So dear students, I'm sure you understand about the epiglottis, function of epiglottis. The next parts of the respiratory system, inshallah, we will discuss in our next lecture. Thank you.